By firefighters. Thank you for that, John. After months of heated debate among lawmakers and the American public, the House of Representatives late tonight passed a landmark measure to overhaul the nation's health care system.
This is a great night, a great victory.
It's been touted as the most sweeping reform of health care in a generation, and tonight that reform legislation was approved by the House in a vote of 220 to 215. The bill did not win bipartisan favor, only one Republican lawmaker voting for its passage. 39 Democrats, in fact, broke ranks to vote against it. Despite the close vote, it is a victory for President Barack Obama, who earlier urged Democrats to answer the call of history. In a final call to arms, President Barack Obama pressed members of the House of Representatives to pass a comprehensive health care reform bill.
The bill that the House has produced will provide stability and security for Americans who have insurance, quality, affordable options for those who don't, and lower costs for American families and American businesses.
The $1.2 trillion measure would require most Americans to carry health insurance and would offer federal subsidies to those who could not afford coverage on their own. Large companies would be compelled to offer coverage to their employees, and both companies and consumers would face financial penalties if they don't comply with the government requirements.
What's in our grasp right now is the chance to prevent a future where every day 14,000 Americans continue to lose their health insurance, and every year 18,000 Americans die because they don't have it.
I talked by phone to Democratic Congresswoman Susan Davis, who says one of the most significant changes will be curbing the power of insurance companies.
Probably one of the biggest changes is that people cannot be denied coverage for a pre-existing condition. It also says that people can be dropped from coverage if they become ill. I think that kind of security, the peace of mind that comes with knowing that your insurance company can't do that to you, will make a big difference for people.
The bill is projected to expand coverage to 36 million uninsured Americans. From Washington, Republican Congressman Brian Bilbray expressed his concern about proper verification for the expanded system.
They'll say that illegals can't be in the program, but you don't allow anybody to check. And you basically, it's almost like a speed limit sign that says, here's the speed limit, but oh, by the way, law enforcement will not enforce the speed limit. So it really is still a stumbling point on this issue.
In San Diego, the group that represents more than 100 nonprofit community clinics in Southern California is praising the legislation. Gary Rotto, who works for the Council of Community Clinics, says with these new reforms, more San Diegans will be able to obtain health insurance.
Of the 556,000 who are uninsured currently, two-thirds of those, or 360,000 people, will now be eligible for insurance.
Two-thirds?
Two-thirds. And this is based upon work that we've been doing with the UCLA Center for Health Policy Research. We believe that this is an historic moment. We believe that this is a time, especially for San Diegans, that we can have that many more people covered and provide health care services in the community. It could make for a healthier community.
And just about 90 minutes ago, Democratic Representative Susan Davis said that the bill puts patients first and works harder to provide consumer protections. But Republican Congressman Darrell Issa said that the measure will cost Americans more jobs, add to our federal deficit, and it will not control the growing cost of health care. Tonight's vote now clears the way for the Senate to take up the issue and start its debate.